Hello, I'm Steve Lockhart and I'm here to talk to you about back pain. Now, I'm sure many of you sitting here watching this are very frustrated at this point. You've probably had your pain for many months, if not years, and you've probably spent hundreds, if not thousands of dollars trying to find a solution without any success. There's probably been dozens of different therapists and doctors that have told you what's wrong with your back and maybe even told you they can fix it, and at this stage you're still suffering, you're still getting problems, and you're still looking for answers. Now, hopefully today in this talk I'm going to give you, I'm going to be able to give you some of those answers, because I'm going to approach back pain a very different way to probably what you've heard previously. I was trained 20 years ago by an old guy in Sydney, Australia, in a special form of body work. It's not a miracle cure. There's no miracles when it comes to back pain. You know, back pain is a problem that is affected or is caused by so many different aspects of our lifestyle. And to deal with it properly, you really need to tackle it from lots of different angles, depending on, of course, the sort of person you are, the particular problem you have, and the lifestyle you've been leading for many years up to this point. I like to think that you can categorize back pain sufferers into three different groups. The first group I like to call the fit and healthy sufferer. The second group I like to call the very unhealthy, stressed sufferer. And the third group is the everyday person. Average diet, not particularly fit and healthy, doesn't do much exercise, doesn't do particularly bad things for their body, but doesn't do particularly good things for their body. It's just in that middle range there. Now, the first group, the fit and healthy sufferer, they've got back pain because they really do care about their body, and a lot of their time during a day is focused on caring and looking after their body, whether it be, you know, making good food choices, turning away or knocking back bad choices like maybe not drinking, smoking, trying to get regular exercise each day so that they keep their circulation going and keep fit and healthy. And they probably wonder a lot as to why they've got back pain. Now, this group of people normally have a healthy, supple sort of body to work with. When I see them in a clinic situation, I find that the main reason that they've got a problem which is sticking around or isn't going away is that their body is out of symmetry. You know, they have a tilt or a twist or a rotation in their pelvis, and that's affecting the pressure that's being exerted on their spine. The fact that they exercise and do things with their life and keep very active can actually work against them in a lot of ways, because as you're going to learn later, it brings into play two extremely important factors which really are the critical factors when it comes to our health and fitness and pain levels. Now, these people are fairly easy to treat in that when I work on their body, their body responds quite well. So often you can find the problem or the cause of their problem in certain muscles in their body which are failing on them and causing the body to become twisted or tilted or out of balance. And it's a situation where once we target those muscles and do some work on them, their improvement is fairly rapid and their progress is steady. And they're able to take away some self-help techniques and do some good things for themselves because they're used to being active and involved in their health and fitness and wanting to help themselves. The program that we're going to talk about a bit later, the self-treatment program that I'm introducing to you here today, is a fantastic way for these people to get better, because the fact that they've trained and exercised their problems into their body, they're normally in a situation where they need to train and exercise them out of their body. It's not the sort of body that you can just do a quick treatment, fix them, they're gone, and that's the last they have a problem, because they are physically active, they are putting a lot of pressure on their body. So by demanding their body goes through a fairly rigorous physical workout, they need to make sure that their body is balanced to start with and stays balanced in whatever they do. So as I say, these people usually respond really well to a self-treatment style program and are in the right groove to be able to work with it. Now the second group of people, the stressed bodies, the unhealthy sort of bodies, are typically a person who has a very busy lifestyle, perhaps their own business, or in a fairly high-powered position where they've got a lot of demands on their time and they need to travel a lot, or spend a lot of time eating out with clients, socializing, drinking alcohol. They don't get much time for exercise. They often have a bit of a weight problem. Their body not necessarily out of balance, but on a physical level, so it's not necessarily the case where they've got twists and tilts in their pelvis or a curve in their spine, but their body is out of balance in other ways, where they're not getting enough sleep, or they're not getting enough exercise, or they're not getting enough good food to balance their tissue and body overall. And so the body becomes very stressed and tight. The circulation's not very good, and everything they do is difficult, because anytime they're putting physical pressure on their body, the muscles tend to fail because they're not in a healthy, good enough condition. Their circulation's not good enough to be able to cope with a lot of different pressure. So these sort of people need to approach their body in a slightly different way to the first group. They still need the exercise and the self-treatment care, but in a more gentle way, and using more to do with diet and detoxing and cleansing, and actually trying to get their circulation improved, the health and suppleness back into their body. Now, the third group of people are the average everyday person. They've got a pretty busy lifestyle. They might do a little bit of exercise here and there, but nothing too serious, not like the first group. And they eat an average sort of diet. They don't go out of their way to eat organic food, or super strict with what they eat. They'll go out and have drinks with friends, they'll socialise a little bit, and they're probably the greater proportion of the population. They're the very middle of the road sort of people, and they don't have undue amounts of stress on their life, but then life's not easy all the time either. So it's a bit of a mixed bag. They have a certain amount of stress in their tissue, but their main problem is just a lack of movement, a lack of exercise, and probably too long neglecting their body, neglecting the attention that they need to their circulation, their posture. These people tend to have, a job which is sitting at a desk or in a repetitive sort of position, where they actually put a lot of pressure on their body over a day, but they don't do anything to remove that pressure at the end of the day. These sort of people, when you treat them, they need a bit of ongoing treatment to get things to change. They need a bit of education and things that they can do for themselves at home. And often they find that a little bit difficult to do and to put the time in, purely because it's not really what they're used to. They're not used to doing regular exercise, and they're not used to doing a lot of self-treatment sort of techniques. Their diet may be pretty established and hard to change, but really, to get over a problem or a back problem, it's not too difficult for these people, providing they're prepared to put a little bit of effort in. So these three groups of people will probably pretty surely sum up you while you're sitting there looking at this. And you'll find that if you're not in one of these groups, you'll be a mixture of probably two of them. You might do a bit more exercise than the average person, but you might do not so much attention to your diet, or you might have a job that is particularly stressful on your body. Somebody that sits at a desk every day, all day, or stands in a shop situation where they've got to stand at a counter for hours on end. It's a real way to lock your body up. And if you're the sort of person that only exercises a couple of times a week, it's really not enough to counter the stress that's putting on your body. So as we go through this information, the self-treatment program, I want to refer to these three different types of people. So again, we've got the fit and healthy person, the stressed person, and the everyday person. And if you can put in your own mind where you fit into the picture, maybe, as I say, a mixture of two of them, And just take note of, as we're going through this program, the different things that are emphasised for you in particular. Because you can find that you may be an everyday sort of person that once was a fit and healthy person, and your back pain has caused you to fall back into that latter group. And it's something that you want to change. You want to work your way back to being fitter and healthier than you are. And it's easy to change groups using this program, because really what we're about is taking your body back many years to how it was when you were a lot younger and a lot more supple, a lot fitter and healthier generally. So by working with the program, you should be able to slowly increase your exercise levels, slowly get into things a little bit more, and slowly get to the point where you can join any group you want. If you're in the middle group, or the third group, sorry, the stressed sufferer, it's probably time that you take a serious look at your life. I'm sure it's been suggested to you that you have surgery to fix your problem. And often with a person that comes in to see me whose body is like this, if I can't get them to change things and to make an effort to really improve their lifestyle and work with me on different things, a lot of the time I'll suggest, look, you may as well have surgery, especially if it's a really severe problem like sciatica and it's causing them quite a problem during their day-to-day life. The trouble is that sometimes you get into such a situation like that with sciatica and you've got really a serious problem to deal with on a day-to-day level, but the changes that you need to make to your body to get you out of that situation take a lot longer than 1 week or 2 weeks. And so it's a bit of a catch-22, because you're constantly being bombarded by this pain and you're trying to make changes and do exercises and changes that are very difficult when you're in that pain. So sometimes people are in a situation where they need to have the surgery just to get them out of that really acute stage. But even when you've done that, it's important that you start looking at your lifestyle and you start working on things so that you don't end up in that same situation again down the track. Because the cause of a person's pain is very different to the symptom. And you'll probably find that what you've been doing very much up to date is treating symptoms. When you go and have an adjustment from a chiropractor, or you get some stretches and exercises from the physiotherapist, or you get some anti-inflammatories or other drugs from the doctor, even surgery, they're all treating symptoms. They're all trying to deal with a point of pressure in your back that is irritating and causing you pain and inflammation. What I'm about is taking the pressure off that area by changing what's happening in the rest of your body. And by doing that, you actually change your whole body. So you find that once the pain goes away, if you continue on with those changes, you're actually coming so far away from that condition that gave you pain that you really don't have to worry anymore. Like, you don't have to be too concerned if you go out and have a bit of a run around with the kids, or you carry some shopping in from the car, or you have to do a little bit of physical work at home sometime, because you're changing your body as a whole, as one, and therefore you're changing the effect or the reaction it has when you do this exercise or when you do these physical activities that normally will put you in trouble. Now, most people with back pain or sciatica tend to go through a stage where they've always got a niggle there, they've always got something wrong, and it's only every so often that it turns into an acute phase. And there's quite a difference between acute pain and chronic pain. Acute pain is where you're really inflamed, very sore, and you really can't do much. You might be spending your time lying down most of the day, or getting a lot of treatment trying to settle it down, doing your stretches and exercises to try and get rid of the acute phase, and then you click back into that chronic phase where you've always got a tight back or you've always got a bit of a niggle. Now, as you're working through this program, you'll remember that I gave you the instant relief technique, where you're using the rubber balls tied or taped together, or the back balls, to work down your rectus spinae muscles and release pressure off your spine that way. Now, these balls, or this technique, is a really good way to take the pain away, the instant pain away, and give yourself some relief so that you can start changing your lifestyle and making the different changes in your exercise routine or whatever you're doing to be able to change the body long term so that it doesn't come back. If you rely purely on this exercise to keep your pain at bay, you may be successful by doing it very regularly, but you'll still be have a vulnerable back where you could slip into that acute phase at any time. So I encourage you to use that exercise to get yourself out of trouble and to get yourself into a position where you can actually carry out the self-treatment program and do all the things necessary to take your body right away from that pain situation. Now, what I do is very different, as I said, to physiotherapy, chiropractic, to what doctors are prescribing, because of the fact that we're working on the whole body. And in some instances, the relief may not be instant. In others, it will. But if it isn't, I don't want you to be too discouraged, because I think logic will tell you that ultimately you need to make some changes to that whole body. You need to make your tissue healthier, more supple, stronger, more elastic, to be able to get to a point where you can have better movement, better flexibility, where you can do things in life without your system shutting down because it's too much pressure on your circulation system. You see, the way the muscles work, and this is very interesting because it's important that you understand this, is that the muscles need circulation. They need fuel to get into the muscle to burn for energy. They need oxygen, they need nutrients coming into the muscle. But just as importantly, they need to get carbon dioxide and waste products out of the muscle. And so if you are making a muscle work for any length of time, you are testing its endurance. And for it to work without failing, it needs to have that good flow of circulation. If it doesn't, the muscle starts to fatigue. And when it fatigues, it tightens up. And when it tightens up, it starts to deteriorate. Because without the oxygen and the nutrients getting in, there is nothing to feed it, to keep the tissues supple, to keep the filaments sliding, to keep it lubricated, so that your muscle can go through that elongating, contracting process it does when it works properly. I find a lot of people with back problems have 1, 2, 3, 4 or more muscles which are very stiff and locked up, and they don't move the way a muscle's supposed to move. So when you stretch it, when you try and exercise it, it doesn't actually work, because the muscle doesn't take the work or doesn't carry the load, because it's not getting the circulation. So circulation is one of the key points as far as a person's health and fitness. We need to improve the circulation around our body to be able to have any hope of making our body healthier. Now, you know yourself that everybody says, oh, exercise is good and exercise keeps you healthy. And the reason it's good is because it improves your circulation. But it doesn't necessarily improve the circulation to all the peripheral areas. It doesn't necessarily get that circulation into some of the critical muscles that may be failing now because you've got a back problem, or because your body is out of balance. So what we do in the program is we find those muscles and we target them, and we do certain techniques to them to break up the congestion, to release the tightness and spasming, and to get the circulation back in there. Now, once we get the circulation back into those muscles, they start to return to a healthier, more supple condition, and they start to work when you exercise them. Because when they're all tight and locked up, they're just like a big stiff band, and they'll just work as one big lump or band. They won't actually exercise, strengthen and move the way you might imagine they do. And that's why when you've been given exercises to do by your therapist to fix your problem, it hasn't worked. They might be trying to strengthen your core, or they might be trying to strengthen the area that's in pain, but it doesn't work because the muscles that are creating a problem are not actually receiving exercise. They've gone too far backwards. They've shut down maybe years ago, maybe months ago. And what we need to do is isolate or find those muscles and get them working again. And that's one of the very important stages that we take you through to get going again. With a person that's the fit and healthy body, there's only going to be a few isolated muscles in that condition. You know, I can remember a patient I had the other day who had chronic lower back and sciatica problems. His body was in great condition. He was healthy and fit, but he was really being brought down by the sciatica. He'd had it for over a year where it had become a serious problem, and the problem he had was isolated to two muscles in the back of his legs that were actually feeding or supporting in his lower back and creating this problem. The rest of his body was fine, and when I worked on him and found those two muscles and treated them, the pain went almost instantly. Now, he could go away after just a couple of sessions and self-treat those muscles himself with some tips that I gave him, and he didn't need to have ongoing treatment or therapy because generally his body was balanced and fine, and he just needed to isolate those two muscles. But he'd been through everything, tried everything to get his back problem fixed, and nothing had worked, simply because those muscles hadn't been found and targeted. So the fit and healthy person is in a pretty good condition, a pretty good position in one way, because they will only have a few isolated muscles to target. And they may have to change their exercise routine for a little while, depending on how much of a twist or tilt's in the body, because the one problem that you have to deal with, or the second problem, we talked about circulation being very important. The other problem that's very important and is very relevant for the fit and healthy body is gravity. Now, people don't really probably think about it, but every time you stand up or sit up, or every time you're upright, you've got the weight of gravity pushing you down. And if you let go of the effort you're putting in to be upright, you'll just fall in a heap on the ground. So every time you're upright, your body is actually working and holding that weight of gravity. And in doing that, the muscles need to actually have endurance and have a certain amount of strength to hold you up. That's why a lot of people, they'll say they get up in the morning, they feel pretty good. They actually don't have any pain at night. They get up in the morning, they feel fine. And it's as the day wears on that their pain starts to get worse and worse. And by the end of the day, they're shot ducks. You know, they come home from work, they've got no energy, they feel locked up and tight. All they can do is sit in a chair and relax. They get through the night, have some dinner, go to bed, and the next morning it's the same cycle. They feel a lot refreshed and okay, and they start to deteriorate as the day goes on. All that means is that the muscles that are causing the problem don't survive the day of holding gravity up. You know, the endurance in those muscles is not very good. So those muscles are not functioning properly. And it may be they're here, there, or everywhere, but when you target those muscles and you improve the condition of them, they get through the whole day without a problem. And that's, one group of people. And then you've got the other group of people who find it difficult at about 3 or 4 o'clock in the morning, where their body starts to ache because of their pain, and they have to get up and move around. And actually, once they're up and moving around and getting going, they feel a lot better. And these people have muscle problems that are extremely tight, and during the process of the night, at 2, 3 o'clock in the morning, when the blood leaves the muscles and goes to the organs to do other work for us, and we naturally stiffen up, that is enough to trip those muscles over the edge and cause them to start aching or irritating a nerve and create this sort of restlessness and waking up. So they're a different group. They actually improve as the day goes on. They haven't got so much of a weakness in their muscles as the first lot, but they have more of a tightness in their muscles, which is irritating. But the same thing, we need to find those muscles and target them and release some of the spasm out of them and the contraction out of them, and get them more so that when they lie down and go to sleep, the muscles actually relax and the circulation can move through them freely. You've got other people who are basically in pain most of the time they're on their feet. And that's because whenever they're upright, their body, and they're lifting and holding the weight of gravity, their body is imbalanced to such a point where it starts to twist or sag. And normally the weight of gravity coming down that is not being carried evenly, and might be carried more on one side than the other, It causes a joint to be rubbing together, to be squashing a disc perhaps, or every bit of movement creates that grinding and rubbing action on the joint, which tends to drive the circulation and pain. This is often for people who have pain around the sacrum, you know, where they have a twist in their pelvis and their sacrum is not moving properly when they walk. Instead it's grating and grinding and rubbing, and it creates a lot of inflammation and pain. Now these people, it is certain muscles that are a problem, but it's normally muscles on one side that are acting differently than the muscles on the other, and they're creating the body to be, causing the body to be twisted. And you need to find these muscles and get them back to their proper condition to allow the body to be straighter. Now these sort of people will look in the mirror and they'll see their body is bent out of shape. You know, they'll see their shoulder dropping on one side or their hips up on one side. You know, they'll notice that they might, you know, getting a pair of suit pants made. One leg's a little bit longer than the other. And there's a physical shape you can see in the body like this. And that's the problem. When you're holding gravity up and supporting the weight of gravity, it's a lot harder for you to do that when your muscles are not balanced. You know, I like to use the analogy of like if you hold a brick in your hand. Now if you hold that straight above your head and your arms straight, you might be able to hold that for say 3-4 minutes before it becomes an unbearable weight and you have to put it down. But if you put that brick forward 6 inches or so and carry it on an angle, you'll deteriorate, your muscle will deteriorate and you'll be aching a lot quicker than that. Because when you're in that position, certain muscles are overworking, trying to carry the load, and other muscles are underworking because the weight's falling to one side and it's not as stressful. And it's exactly the same with the body. When your body is tilting or lapsing to one side, it's causing certain muscles to overwork and other muscles to underwork. And that exacerbates the imbalance that you've got. And it causes a joint to sit a little bit crooked. So you might find that it's rubbing on one side and it's open on the other. And so you might wear a joint out. It's like people that need a hip replacement when they're 60 years old. You know, everybody else in the population doesn't, but there's a group of people that do. You know, the reason why is because their body hasn't been balanced for a long time. And they'll have noticed that they walk with a limp, or they walk very awkwardly and it's painful to walk. They get tired very easily, their legs get heavy, their back gets heavy. If you've got low energy, you know, if you're one of these people that falls asleep or wants to sleep at 3:30 in the afternoon and 9 o'clock at night, you know, you're finished and you've got to go to bed, there's a very, very good chance that your body is out of balance. You have either a leg shorter than the other, your pelvis is tilting or twisting, and it's causing you to lock up in a certain part of your back, which greatly affects the energy. And this is quite amazing because it's something I discovered, and I did a lot of work with chronic fatigue sufferers, because a lot of chronic fatigue sufferers, they're underpinned by this muscle imbalance, which is creating a real blockage in a certain point on their back. And I found that when I was able to unravel the imbalances in their body and straighten their body up and open the energy flow through their spine, their chronic fatigue just faded away. Now, chronic fatigue has many other causes, and we won't get into that today because it's a whole nother subject. But suffice to say, if you've got low energy problems, digestive problems, headaches, fogginess in the brain, perhaps problems with your eyes, and these sorts of symptoms, you've probably got a back problem as well. And you may not realise just how closely connected they are. But again, by rebuilding your body, putting the balance back into your body, putting the health and suppleness into the muscle tissue, correcting your posture, and making your body stand straight and hold gravity in a balanced way when you move around, and enabling your body to get stronger and respond to the exercise you're doing because it's balanced, you may well find that not only your back pain goes away, but you start getting all your energy back, and these other symptoms go away as well. And this is all part of the self-treatment program that we're going to go on to. It really is important that when you deal with a back problem, whether it be sciatica or or back pain or whatever, upper back, middle back, lower back, even hips, knees and other joints that are giving you a problem. When you deal with these problems, you need to take a holistic view of it. You need to treat the whole body. And if you're getting treatment now, which is only targeting one particular part of your body, perhaps where you've got the pain, more likely where you've got the pain, then you're probably just wasting your time and money. And you may have already found that in the past. You may be looking at this video after giving up on all the therapists and therapies and thinking that nothing's working, you're not going to get rid of your pain, but hey, I may as well see what this guy's got to say, and you're having a look. If that's you, there is a real way you can help yourself. This is going to be very different, as I said, to what you've been doing in the past. But if you approach it on a whole body aspect, you're going to find that the results you get are very different to what you've got before. And it really doesn't matter what else you do to the body. If you're out of balance, if every time you stand and sit, your body sags or twists or falls into a pattern that it's been in for a long time, that generates your pain and inflammation, it doesn't matter what else you do, you'll never get rid of it, the problem, the pain and that inflammation. And even if you do a little bit of stretching, a little bit of exercise, and you find that that holds it away or keeps it at bay, it's still not dealing with the cause. Now, a lot of you will tell me that stretching doesn't work either. And I found that to be the case for most people with chronic pain, because the muscles are not responsive to that sort of thing. They need to be activated, they need to be woken up and brought back to life before you've got any chance of that happening. And you know, I've got a whole other theory on why stretching doesn't work anyway, which you can read about through my blog. But what if you're finding that, you know, the exercises and stretches that you're being given just irritate you and cause a problem, there's a good chance that that's the reason why. The person who is the fit, healthy person, sufferer, you've probably done a lot of stretching because, you know, it goes hand in hand with your exercise. And if you've stayed fit and healthy, then stretching's been a reasonably big part of your life. And it does tend to help your body compensate for imbalances and problems it has. People with chronic pain do tend to, you know, the fit and healthy people with chronic pain do tend to keep it away until they're older, when the body's ran out of places or ways to compensate. And it's not until that happens that the pain sets in and becomes really hard to shift. And if you're in that position now, it's really time to reassess things and time to take a different approach, because you can still get better, but you need to do it a different way, because stretching has its limitations greatly. If you're the average person who isn't doing a lot of exercise generally and is just living a pretty normal life, the chances are you're not in as much pain, or you're not in so much pain that you're motivated to really work at things every day. But if you allow your body to continue to slowly deteriorate, which is what happens when you block a muscle up and you don't get good circulation there, then the really bad pain is probably ahead of you. And it's a good idea to start targeting it now and get something done before it gets to that stage. Now, the average pain sufferer is probably also someone that doesn't have a lot of energy. As I say, it ties in very closely with the back. So if you're in that position, like you come home at the end of the day and it takes all your energy to cook dinner or to get dinner and, you know, get the family sorted for the night, you'll tell me, or they tell me all the time, I just don't have the energy to do any exercise. You'll find that exercise actually gives you energy. Once you can stimulate your circulation and get your body moving and get the chi or the life force energy flowing back through your body freely, you'll actually have a lot more energy. And again, it's a bit of a catch-22. You know, you come home, you've got no energy, so you don't exercise and your body just keeps deteriorating. But you have to reverse that. You have to go through a time when it's a bit difficult because you've got to force yourself through the different things. and you start to come out of it and start to get energy from what you're doing. Now the good news is the self-treatment program that I advocate is not one of those pounding, sweating, calorie burning type workouts. When you're trying to coax the circulation through your body, when you're trying to get the energy moving back through your body again, you need to do it in quite a gentle way, because as soon as you put too much pressure on it, everything just shuts down. If it's not getting the oxygen and nutrients into the muscle fast enough to provide the fuel and the burning that you're doing with a hard exercise, the muscle just shuts down. And again, if you're not getting the waste products and the carbon dioxide out, then the whole system just doesn't work. So the muscle drops out of play and doesn't get involved in the exercise. And that's why you then start irritating the problem and making it worse. Walking is something that most people will say, like I'll say, do you do any exercise? And they say, oh, I walk a lot. And walking is good for some back pain sufferers, but it's not good for a lot of others. If you've got a rotation or a tilt in your pelvis, walking is not a good thing to do, because it causes that grinding and irritation in your lower back around the joints, and it will cause a lot of deterioration in the vertebrae and the bones over time. So if you're a person that, when we go through the assessment stage and we show you how to assess your body and work out what is actually causing your pain, where your body has its weaknesses or faults, and you find that you've got a twist or tilt in your pelvis, then walking is not something you should be doing at this stage. A lot of the exercises that I advocate in the early stages, the gentle movement and circulation stimulating exercises, are actually done either lying on the floor or in a water. There's very few things you can do on land unless your problem is just, say, you're in the stressed group, where your body is just tight all over and you just need to get your body moving. You spend too long sitting in a car, too long sitting at a desk, too long stressing, too long not moving your body, not getting enough sleep, and causing your whole system to be stiff and tight. If you know that your body is very stiff and tight and you've got very limited flexibility, sitting around makes you tired, you need 7, 8 hours a day to get through the day, 7, 8 hours sleep to get through the day. If you're like that, then your body is very congested, very blocked, and the energy isn't moving properly, the circulation isn't moving properly. You're on a train ride where back pain is one of the stops. But the problem is that heart disease, diabetes, arthritis, cancer could well be stops on that same ride. If you're on that ride, you need to get off the train. You need to change tracks, because if you don't, things will get worse. Things deteriorate over time. The pain you might be feeling, the little symptoms you might be getting now, they're the taps on the shoulder, they're the warning signs that you're on the wrong train, you're on the wrong track. If you don't listen to those warning signs, then there is no way that you're going to stay on that track and get pain-free. There's no miracle cure. You've got to start asking yourself the question, are the rewards, or is what you're getting out of that ride worth it to watch your body just be driven into poor health and perhaps disease? It's a really serious issue for you people. If you're that tight, stressed, overweight body and you've got back pain, that could be the least of your problems in the future. There's no, even when someone comes in to see me like that, I can't do anything with them, because when I work on their body, it doesn't change. They get off the table, they might feel better, but in a few days they're no better. They're the same as they were, perhaps a week. Now some of the people will come every week just to carry them through that period. They've got lots of money, I don't care. They'd just rather me carry them along. But it really is just starving off the inevitable, because as soon as they stop seeing me, everything just falls back to where it was. And you know, the body work I do is not going to stop them getting diabetes or heart disease or cancer or any other disease that comes with that sort of poor health and that general stress level that they're inflicting on their body. You know, that's something that's just out of our control. So if you're in that group, you're going to find that certain aspects of the self-treatment program are critically important to you, and other aspects are going to have to be put off a little bit, or they're not going to be as beneficial to you right now. They're going to be things that you can start doing once you get your body into a more, you know, healthy, supple state. You know, the last thing I want to do or see is one of these stressed, tight, unhealthy people doing any sort of sweating, vigorous exercise. You know, I see them in the street sometimes jogging, and I just think, you know, they're putting themselves at such risk because the system is not healthy enough to support that sort of pressure. You know, hard sweating exercise is not what you should be doing when you're in that condition. You need to cleanse your body. You need to detox your body. You need to flush out, change your diet, clean out your system. Now I'm going to give you lots of good information on that too. Now the fit, healthy person isn't going to get as much value from that information because they already know it, they already do it. Their body isn't in that condition, it doesn't need to be brought back from that. The middle of the road person, you know, they need to know that. And they might not be as bad as our stressed friend, but they're tending to that way. They've got a bit of it going on. And by doing that sort of stuff, they're only going to feel better. They're only going to make their body more responsive and work better to the self-treatment techniques that we're going to go through. The gentle exercise, the self-treatment work with a rubber ball, the SLM yoga, which is such an amazing program you can use to control your energy levels and your suppleness and balance on a day-to-day basis. The people who are the fit and healthy sufferers, the SLM yoga is going to be an absolute amazing tool for you, because you're going to you're going to respond to that virtually instantly. From the day you start doing it, you're just going to come alive, and you're going to find that it really helps to put balance and take away your pain. And the other things you can do, the SLM yoga isn't designed to target the really specifically problem muscles and do enough for them to be able to bring them back, because we use other techniques to target and work on them. But the SLM yoga is the all over body balancing, all over energy moving, stimulating technique. And the fit and healthy sufferers will get a really fast response to it. The middle of the road people will also get a good response to it, but the stressed person will probably find it's very difficult to do up front, because it requires a bit of flexibility which they don't have, and it requires being able to switch on the different muscle groups. And because most of the muscles are so tight and inactive in their body, that it'll be very difficult for them to connect with them and actually get anything happening. But that will come with time. So it's important that the different parts of the program that are relevant for you, it's important that you really embrace the step that you're at and work with that. And we'll point that out as we go along. Now, the people who have structural problems in their body, because there's a lot of people going around that actually have, you know, a label has been put on them. It may be spondylolisthesis, it may be scoliosis, disc bulge, herniation, disc herniation. They may be talking about arthritis. All of these conditions or labels that have been put on you are not really anything to get too concerned about. And although no body work or treatment like we're approaching it here are going to make any dramatic changes to those conditions straight away, it's important that you realise that when they did studies and took, 100 people over the age of 50 that had no incidence of back pain, no problems whatsoever that they were aware of, and they did scans on them, they found that a high majority or high percentage of them had all these conditions, you know, the bulging discs, the degeneration. And what they concluded was that perhaps these conditions are not actually the reason why someone's got pain. Now what happens, of course, is you go to the doctor, you say you've got pain, and you get a scan, and they look at the scan and they say, oh, you've got a bulging disc, or look, you've got this degeneration here. So they assume that that's the reason for your pain. But it may well not be. And so if you're sitting here watching this and you're thinking, oh, this won't help me because I've got such and such or such and such, don't write it off so quickly. Don't be so quick to say, I can't be fixed. Because really, when you change the general health and condition of your body, when you improve your circulation and actually make your energy and circulation move freely through your body, you get your muscles more balanced and healthy, you put some strength back into the muscles, you'll be amazed at how that changes symptoms and pain levels in your body without having any effect on those conditions. You know, I had a patient came to me once with a ruptured disc. He had a scan, an MRI scan, that showed the fluid all leaked out of the disc and all down around his spine. And the surgeon that looked at it, the neurosurgeon, said, you must have surgery on this. You can't fix this problem without surgery. You know, the physiotherapist with 20 years experience spent the majority of the appointment with him convincing him that he knew this problem and he had so much experience that he should listen to this guy when he said you cannot avoid surgery with this. Now this guy had this obsession about not having surgery, and when he came to me he said, look, you know, can you help me? I just do not want to have surgery. And I said, look, I can't promise you anything, but I'm certainly happy to give it a go. When he came over to me in the early stages, he used to lie in the back seat of his van, his father's van. He get delivered here to my place. And he would come in all bent to one side. So his body was so bent over and he was in so much pain. He couldn't even lie on the table on the first appointment. I needed him to lay down, face down on the table so that I could start to do some work on him. And he couldn't do it. And so what I did was I had him lie down on his back on the floor and I gave him a rubber ball and I talked him through different acupressure points to work on. And I said to him, we did that for an hour, and I helped him up and I said, go home and use that ball and don't come back until you can lie face down on the table. And keep using those techniques until you can do that. And it took him 2 weeks. And then he rang me and said he could lie on the table, came in and we started treatment. Now it took many months, 3-4 months of weekly treatment to get him pain-free. And he came to me for probably 18 months, although, you know, the time between the treatments was stretching out more and more. But 18 months later, he was back in the gym, he was lost weight, he was fit, healthy, strong, he was training. You know, you would not know he had a problem. And I guarantee you, if you had a scan of his body after, he would still show the ruptured disc. And I was even, you know, quite surprised that it actually got as good as it did. But I was positive for his sake. But in my own mind, I thought this is going to be interesting because I'd never actually got someone with a ruptured disc out of pain before. And he had to, you know, go through quite a bit of pain in those early stages, putting up with quite a bit of pain to actually have the faith to actually do this. But he was in the pool as soon as he could be. He had traction from a physiotherapist as well to help take some pressure off the disc. But he came good. And so all I'm sort of making the point with this is don't get too carried away or too concerned with the fact that you might have some structural defects or stuff going on in your spine. Okay? There are still a lot of things that can come good, a lot of pains that can disappear, and you may find that you're totally pain-free with this self-treatment approach and all the things that we're going to go through. So, just in summary again, we're looking at 3 different groups of people. Okay, and hopefully you've been able to classify yourselves as one of those, where we're going to take you through a step-by-step program, and there's going to be gentle exercise, there's going to be self-treatment techniques that you do to yourself, there's going to be cleansing, changes in diet, there's going to be a lot of education along the way. And at the end of this program, you're really going to know a lot about your body and about health in general. And if you never in the past, if you didn't think about how much that was impacting or being a part of your back pain, you're going to realize that it really does play quite a significant role. You know, the people who don't have, or the people who have a healthier, stronger body do not suffer with back pain the way that the weaker, unhealthier people do. Now, I really encourage you to give this program a try, to work with me through this, be able to ask any questions that come up along the way, because I know that at the end of the day, it'll work for most people, and if it doesn't work for you, as far as taking away your pain, it's going to make an improvement to some degree, and it's going to make your whole health generally a lot better. You're going to have more energy, and you're going to feel a lot better. You're going to function better at work, you're going to function better at home. And as far as taking away the pain, if you are somebody that needs to have that surgery and needs to go that step, which is, you know, quite a big step for a lot of people, at least the chances of you coming out of that pain-free are going to be so much higher by having a stronger, healthier, more balanced body. You know, surgeries have about a 50% success rate. And one of the big reasons that a lot of people don't get better when they have surgery is because of the imbalances and the general condition of their body before they have it. You could almost predict the people that are going to have success with surgery because they're the people whose bodies are basically strong and balanced to start with. So even if that is a step that you have to take at some point, you know, you'll be a lot more you can be a lot more reassured that the success of it is much higher, much more likely when you've looked after your body and you've got yourself into that healthier, more balanced condition. Now we're going to talk about lots of different things, you know, even if you've got bad habits like smoking, or, you know, you're drinking too much and you find it very hard to cut those things down with the lifestyle you've got, you're going to find there are ways you can deal with that, and very powerful ways. And it's a matter of you bringing everything together. And a lot of this is about knowledge. You need to understand what you have to do and how the best way is to do it. So the weeks that we go through, there'll be the lessons that I give you on the parts of the body and the different exercises and self-treatment techniques to do, but there'll be additional information from experts in their own field that I'll source and provide for you to give you that more complete picture, to give you more of a general grounding so that you can take care of the whole health picture. And it's not just the body work, it's not just the diet. It's not just the posture, you know, not just reducing your stress levels, but they're all important, and they're all going to be brought in together as part of the program. So I hope to see you down the track, and you know, I look forward to your questions, and any way I can help you, any way I can motivate you to keep going with this, so that you'll find that at the end of it you'll be able to look back and have learned so much and improved so much and be really happy that you've taken this step. So for now, bye bye, thanks for joining me. I hope you enjoyed the talk, and I look forward to speaking to you again soon. Bye bye.